Hi, we're some of this year's pre-health ambassadors on the pre-PA and the pre-PT track, and today we're going to talk to you about women's health in our respective fields. So first, I'm going to focus on the PA's role in women's health. PAs can specialize in women's health and work in both inpatient and outpatient OBGYN settings. Although PAs have a wide scope of practice, the most common things they do involve pelvic breast exams, address gynecological and menopausal complaints, help with family planning and pre and postnatal care. PAs can also evaluate and treat infertility and prescribe and help with contraception. PAs can also perform a number of gynecological surgical procedures. So as you can see, there's a lot that a PA can do in women's health. Emma and Doria are going to talk a little bit more about the PT's involvement within women's health.
So I'm going to be talking about pelvic floor physical therapy. Pelvic floor therapy is a treatment approach that uses physical therapy to provide a structured, effective, and safe reconditioning of the pelvic floor muscles. The end goal of this treatment is to improve strength and function of the pelvic floor muscles to alleviate pain and weakness. The therapist may either stretch the muscles if they are short and contracted or apply resistance to improve strength if they are weak and dysfunctional. So who needs pelvic floor therapy? It's recommended as a first-line remedy for many disorders of the pelvic region. Both men and women with weakness in pelvic floor muscles can perform exercises to strengthen the floor and enhance bowel and bladder control. Patients are referred to pelvic floor therapy when they have inconsistent chronic pelvic pain and difficulty with bowel movements or urination. And how does pelvic floor physical therapy work? A thorough orthopedic examination is performed with close attention to the lumbar spine and hips, gait and posture. The assessment includes evaluation of both internal and external muscles. And a treatment plan may include stretching or strengthening exercises of the legs, trunk, or pelvic muscles, relaxation and exercises for shortened pelvic muscles, education in self-management and prevention, and coordination exercises.
So physical therapy focuses on improving the lives of patients by stretching and strengthening their muscles. A new specialty that's arisen, whatever way you would like to say that, is women's health. This can mean a multitude of things. Specifically, after birth, a woman's body is stretched out after having a child, pop out of there, and it needs to be brought back to normal and strengthened. All of those muscles have been stretched so much that they just need to be tightened. So physical therapists can help with that. Also, the vaginal walls can tighten when having pelvic exams. So that shows how not only are physical therapists working with other specialties like OB-GYNs, we're also helping in our own lane, and others too. So it helps with getting STI tests and finding cancer in women, which is crazy to think that physical therapists do that because we only think they help stretch people out, but they actually do a lot more. So yeah, it's cool how women's health is growing in that field.
There's a lot of things that PAs and PTs can do to help within the women's health field. And so thank you for learning more about that today. And we hope you guys are having a good first year at URI or whichever year you're in. Thanks. That was